watching from Europe, and good morning to all of you that are watching from America. I'm thrilled to present this academic talk, COVID-19 and its impact in Latin America experience in Mexico. I would like to first thank the University of Dundee to provide this opportunity, this space, and especially the Institute for Social Sciences Research, the ESSR, as they helped us to organize the talk, and also the Geography Department at the University of Dundee. I would like to extend our appreciation to our partners in Mexico, the Center for Research and Teaching in Economics, CIDE, and also PADECI. This academic talk, I would like to also introduce the team who's behind the organization of this talk. This is academic subcommittee of Latin American Society at the University of Dundee. I would like to also introduce two of our main projects. The first one is monitoring COVID-19 in Latin America. We do it in a weekly basis. We monitor some news in some countries of the South America and Mesoamerica region, and we share it with our members. And also these academic talks, this is going to be the very first one. And we would like to do a series of these talks with presenting present issues happening in Latin America. I would like to also introduce, the speakers. I think that we have a high-level panel. Javier Contreras, he's going to talk about the panorama of women in Mexico during COVID-19. Marta Arevalo, she's going to talk about judicial systems and women in Mexico during COVID-19. Fernando Alarid-Escudero, he's going to talk about evidence-based public health policies. And Roeland Hemsteede, he's going to close the academic talk with contingency plans from a social protection perspective. In the end, we are going to have a Q&A session. I would like to kick off this presentation with this paragraph by Gerardo Noto from the UNDP. And it says the rapid spread, can you please accept it? Sorry, the rapid spread of coronavirus has shocked the world. The International Labour Organization estimates the global economy will lose more than 195 million jobs. It is expected that the pandemic will hit developing countries harder. An effective response must be driven by solidarity, science, and human rights, whilst focusing on the most vulnerable. So our first speaker, Javier Contreras. Javier, could you walk us through the human rights panorama before COVID-19 and how the pandemic is affecting particularly women? The floor is yours. Thank you.
Thank you. I would like to give my thanks to the Dundee University for this special opportunity to talk with you about the violence against women panorama during COVID-19. And my special thanks also to Evelyn that has made a marvelous work in organizing this event. So, okay, I'm going to start my presentation. Can we move to the next slide? Okay. Could we, yeah, thank you. Okay, so one of the issues that has worried human rights defenders in Mexico during the pandemic and has a very important discussion in the media is violence against women. And it has been a topic that has been discussed a lot also in the national conferences with the president and also treated in the vespertine talks with the health secretary. But this is a very complex topic, and to understand the complexity of it, we need to understand some of the context before COVID and during COVID. So the first thing we need to know about violence against women is that Mexico faces an old-rooted problem with generalized violence and the normalization of it, not only against women, but the cult of violence in general. So we have a really, really big trouble with it. And we cannot address violence against women without acknowledging that it is embedded within a bigger spectrum of generalized violence. So this is a very first topic, and I need to get clear. But we also have another problem. So we go to the next one. That is that we face as every part in the world, but especially in Latin America, it's a big issue. A lot of gender inequality. So we have serious problems to break these walls that separates the opportunities to men and women, and this provokes also worst scenario that can provoke violence against women. Okay, so we can go to the next one. Okay, and the next one. Okay. Okay. Let's move to the next one. Okay. Also, we have gender stereotypes in our culture that promote intolerant violence against women, and they are deeply transmitted within generations in our country from years. So there is a chart that I'm going to put you in the next slide that is from a diagnostic that made on women in 2017 about the femicide violence in Mexico. And it's really interesting because, yeah, that's one. It shows us that the violence against women and extreme forms of violence against women have been happening in Mexico for many years. But we had a special grow up of the violence against women since 2008. And it is coincident with the beginning of an event in Mexico that we know today as the war against drug trafficking. So we have been facing a growing up in these numbers of extreme forms of violence since then, and these numbers have provoked a lot of movement against to try to stop it. But we have a lot of forms of violence against women in Mexico. No? This is a national survey on the dynamics of household relationships that we do each 5 years. And in 2016, it showed up that women that suffer some type of violence at some time in their lives were about 70% of the women in Mexico. So it's a really high number of women that suffer violence. Also, we know from that survey that the women who have suffered violence and didn't report it to the authorities were about the 80%. So this also shows up a big crisis in facing the problem, in that problem doesn't trust in the authorities to go and solve the problems. And it is because a lot of reasons, no? And they are related also with the first problem I was talking about. It also says that women who have suffered some type of violence by their current partner or in their last relationship were about 46%. So it tells us a lot about what's happening inside the houses or the homes of the women in Mexico. So the violence happens inside their homes a lot of times. Also, we have emblematic cases and international interventions in Mexico that have changed a lot of things here in our country. Like, for example, the Campo Algodoneros case of the Inter-American Court of Human Rights that made an international recognition of the systematic and institutional violation of women's rights in Mexico. This is really important because it shows to us that we promote violence in a way from the authorities themselves. So in a general review or in a summary of these big causes, we have four important topics: generalized violence, gender inequality, gender stereotypes that promote and tolerate violence against women, and systematic and institutionalized violence against women. So these four causes must be addressed if we want to resolve this problem. So the government's response to this crisis have been really complex, and I need to recognize that local and national authorities have done a lot of programs, have promoted a lot of legislations, created new institutions, and developed a lot of tools to help women to address this violation to their rights. And we have now in Mexico a really complex and big number of institutions that help women. And this is a big reason of this is because we have big efforts of civil society organizations that have been promoting this transformation in the local and the national level. And it has been a bidirectional relationship between civil society and government. So a lot of the institutions that have been developed in this topic have taken their designs from the NGOs' ideas and initiatives. But the problem is it has worked, no? So I need to say also that this is like something like, for me, is really like interesting that we have found our governments being deeply transformed in the way they assume violence against women, implementing affirmative actions, gender perspective incorporation, and the important role that feminist women are making by being part of the decision-making positions. I need to say a lot of things have changed, but the problem is that even if we have changed the way we see this problem, we see violence against women, even if we have introduced a lot of concepts and norms and laws, the problem is that violence against women has not decreased. So it appears that everything that has been done since 15 years hasn't worked at all. And this is a serious thing. So if we see the national female death cases rates with presumption of homicide or femicides, we're going to see that in the last 5 years, we haven't changed the tendency, and it is getting worse each time. So if you can go to the next slide. Okay. No.
I'm sorry, she's run, Javier.
Yeah, these four slides show us a tendency of an increasing number of crimes committed against women with homicides and femicides, for example. This is the first part. Then in the second chart, you can find the rate, no, la tasa in Spanish, sorry. And if you go to the fourth slide, you're going to see the national female injuries crimes rates, and you're going to see also that we haven't decreased it in a considerate way. So the feminist movement in Mexico is claiming us that we need to provoke a real strategy that could help the women and could save the women and guarantee them their access to a life without violence. But we have these two very specific cases that happened this year, Ingrid Escamilla case and Fatima Albriguet case, a little girl, whose femicides were really a bomb in the media because they showed a lot of the problems that we are facing in the justice administration. when these terrible tragedies happened. So it provoked that in the March of the 8th of March of the Women's Day in Mexico, we had an unprecedented congregation of women in all the country. And this event, this march, really set a big statement to a lot of people, not only to the government, but to the country as a society, that we need to change our cultural view of the problem. We need to change the forms that we are using to address the situation, because we are not solving the problem. And it was really interesting because the women got out their cities. They went to the streets as we have never saw it in any other movement. And just after this great movement and this took off the cities, we entered to the COVID-19 politics and all this great crisis of public health that is making us to stay in our homes. So it has been like a really big contrast, no? Of in the same month, seeing these two different great events in Mexico's history. So what is happening right now with the COVID-19 strategy from the federal and local governments? I think my partners are going to talk much more about this. I'm trying to give you more like an overview of the problems with violence against women, but we do have a national strategy that is every day at 7 o'clock being informed to the people. This person, the character, Hugo López-Gatell, being the representative, the speaker of the government, to try to articulate all the efforts of the government, even the related violence topics. And we have a great and big federal coordination to have a lot of tools and information to spread to the people. But and also we have some specific strategies on public policies that have been directed to attend violence against women. And we have national campaigns. We have focus in empowering and helping to improve the services that could help them in taking care of themselves in the social distancement measures. But if we remember the 4 causes that provoke violence against women in Mexico, we can see that in this moment, these 4 causes have reasons to increase, because organized crime continues to operate despite social distancing measures, because women's work makes them more vulnerable to the pandemic. So it's more probable that they are the ones that have to continue going to work because the work distribution in Mexico, because victims stay longer in the same place as their aggressors most of the times, and because government offices, lockdown and austerity measures have provoked that difficulties to attend violence against women in this scenario. So it has been an increasing in the rates of crimes in the quarantine, in the pandemic duration in Mexico. So we have, in the comparison between femicides from January to March in 2019 and 2020, it has been an increasement of 1.7%. We have also an increasing in the homicides. We have also an increasement in crimes against liberty and sexual integrity. And we have a very big increasement in the emergency calls related to incidents of violence against women. So we have a 66% of increasement, so it's really big. And we have received pronouncements of international organizations about this topic, before and during the COVID, from UN Women, from the MESECBI, that is the experts committee of the OAS, to give following to the Belém do Pará Convention, and a very important resolution of the Inter-American Commission of Human Rights that address the specific measures that must be taken to give this public health situation a gender perspective. Also, we have severe studies and pronouncements of civil society organizations about the functioning of the justice system, the quality of the national phone number to address violence against women and other topics. So I will conclude to say that in Mexico, we are looking this as not only as a public health emergency, but also as a security emergency. We have in Mexico an instrument, a mechanism in the law that is called the National Violence Against Women Alert. And we have 20 national alerts and 6 petitions in process. So we practically have all the country in the no? And we need to address it with institutional redesign. And we have a strategy in Mexico that is called the new normality strategy, but we cannot return in this topic to our past normality. We need to build a new Mexico that could guarantee women access to a life without violence. And it can be an opportunity. So we cannot wait until it ends, because we need to, because COVID is not going to go in the midterm. So we need to take advantage that we are provoking a lot of interinstitutional collaboration because of COVID to create a better agenda to address violence against women. We are working really hard to have a data systematization in a national way, much better than we have it right now, and to introduce the use of the ICTs. But the most important thing, and I need to recommend that it must be done also with our high-level functionaries and politicians, is a change of mentality. We need to recognize, and we need to do a lot of teaching, promotion, that we do have a big problem of violence against women in Mexico, and that helping and addressing it, it's also going to help the health measures and to help us to be safe, everyone. So that will be my presentation. Thank you.
Thank you very much, Javier. We appreciate your insights about how women are particularly affected by COVID-19. And I think this also paved the road for our next speaker, Marta Arevalo. She's going to talk about the judicial system and women in Mexico during COVID-19. This is a special case study. So Marta, what can you tell us about the current situation on judicial systems and women in Mexico? The floor is yours.
Thank you. First of all, thank you, Evelyn, for the invitation and the team. And Javier, you did an amazing introduction to what I'm just going to present. Can you please go to the next slide? Next. Well, first of all, I would like to say that for the first time we have Secretary of the Interior, which is in some other countries it's called a Ministry of Home Affairs, a Ministry of Internal Affairs. And for the first time we have a woman as the Ministry, as the Secretary of the Interior here in Mexico. And she's not only a woman, but she's a feminist. And it has helped us achieve more projects towards the agenda in reference of the movement of gender equality here in Mexico. And I will just mention a few things that also Javier introduced. 2 out of every 3 women in Mexico have suffered at least one act of gender-based violence, and women represent 40% of the workforce in Mexico. And of the 25 countries with the highest rate of feminicides in the world, 14 countries are in Latin America. And we also have a high impunity rate in Mexico. It's close to 90%. So that means that of every 10 crimes committed here in Mexico, 9 crimes are not reported and therefore are not even investigated. And that's really, really bad because we're only working with that 10% of the crimes. And then I'm going to talk about the amnesty law and the context of women in prisons here in Mexico. This amnesty law was a mechanism of transitional justice here in Mexico. And as some of you already know, in 2006, there was an ongoing, or since 2006, there has been an ongoing violence or a drug on wars, and it has just exacerbated the violence towards women and in general. And this mechanism was brought by the president, the Mexican president, but it was approved 2 or 3 weeks ago by the Senate. And it has the intention to set free prisoners for minor crimes such as robbery without violence and health crimes such as drug consumption and possession of drugs, and some other crimes committed by indigenous groups, especially those groups who didn't have access to an interpreter. As you already know, we have over than 100 indigenous languages here in Mexico officially. And the conditions in the prisons are also not very good here in Mexico. Of the 300 prisons in operation in Mexico, 106 have more inmates than spaces available for them. So that means that we have an overcrowding problem. And in this condition, it's very hard to keep social distance. We have also a problem of basic needs, a lack of basic needs such as soap or even water in some prisons. And this law was intended for only federal crimes. So in Mexico, 80% of the crimes are in the local level. I mean, in the local jurisdiction. So this law is only focused on this 20% of federal crimes. And when this law before this law was approved, there was a big debate here in Mexico because people thought that we would set free people who had committed murders or kidnappers and so on. And that's far from the truth because it's only a law that aims to address minor crimes. And we have also around 400 children under the age of 6 years old who live with their mothers in prison. And that also makes it a big challenge for us during this COVID-19. We have some challenges and opportunities, such as if we wanted to have a bigger impact of having more people be free from this law, we would have to implement it in the local jurisdiction. And it's a very political issue because not every state within Mexico, we have 32 states, not every state has the willingness to approve these amnesty laws, but we have seen some intention of a few states already doing the effort to implement it. And we can also use some existing mechanisms outside the amnesty law, such as the National Law of Penal Execution, that has some conditions for people to be free if they comply with certain conditions. And also we need to have in mind that it's a very long process for prisoners to be free, because it's them for us to say to the government, hey, I am a candidate and you need to review my criminal record, and then the process starts. So it's not very an immediate solution, but it counts as a big effort from the government. Next slide, please. And as Javier mentioned, we have a national strategy. This national strategy is for the protection of women, children, and adolescents living gender-based violence. And it's an effort that started in 2019 with the leadership of our ministry. And it focuses services in 7 areas: primary, secondary, and tertiary prevention, but also follow-up, planning and budget, statistics, and also the analysis of the law. And basically, this national strategy, what aims is to gather all these different institutions in Mexico that work with gender, that have an agenda on gender, and we are discussing the big topics, because when we review the budget, the federal budget, we realize that most of the money it's within a bag, but this bag is it's more like focus on capacity or training for the prevention of violence, and we realize that the main problem is not there. Mexico is spending a lot of money in capacity and training or empowerment activities or classes that sometimes sound even funny when you train women on how to do your nails, for example. We have those kind of working online classes. So we are trying to reorganize the budget in the sense that the women need to know where to go in case of violence. So right now, all the efforts looked like they were just spread out throughout the government. And what this strategy is doing is basically gathering all those strategies and saying, we need to work together, because otherwise we are just spending money and we won't see an effectiveness or an impact on those efforts. And it's also focusing in the tertiary prevention, which is focused on the health sector and the judicial system sector also. And Mexico has also launched in the past weeks a few platforms, a few websites. The one that Javier showed is the one that I'm presenting here, and it shows basically all the more than 12 services for women, children, and adolescents in situations of violence. And basically what we did was to train 9/11 operators. So when women would call for an emergency, they would know where to send them, because we have so many institutions and so many departments and sectors that even us, like normal citizens, don't know where to go when something happens. So we launched that website, and also the federal government launched a coronavirus website related to violence against women. And you can find like videos, documents, reports, data, and all those kind of things. But of course, it shows a challenge, because in a country with 50 million people living in poverty, it's very hard for them to have access to the internet or even to a computer. So I will just conclude saying that we need to come up with solutions, innovative solutions to address this topic, because currently many institutions that work in the judicial system are closed because of the coronavirus. And we need to find ways to keep operating, to have maybe online trials, online audiences, in order to not have a sense of impunity and keep justice going. And in that sense, we need to address also not only the judicial system, but the education system. There's a gender gap, and the Ebola, SARS, or H1N1 crisis have shown that boys go back to school faster than girls, and there's a high dropout of girls. So we need to address that. Also the economy. We have a very informal economy, and many women work as domestic workers, meaning like they clean houses. So we need to come up with innovative solutions. In that sense, I have seen that many social organizations are addressing this topic. And just to say that this health crisis, the coronavirus, is not gender neutral. So we need to address that from the beginning. Thank you.
Thank you very much, Martha. With you, we conclude the first segment of the academic talk. To start the second half, which is more policy oriented. And we're going to start with this paragraph from the Health and Sustainable Development Report 2002 by the World Health Organization. Health is now beginning to shape governments and global policies, but now knowledge is accumulating about how ill health creates and perpetuates poverty, triggering a vicious cycle which hampers economic and social development. The next speaker, Fernando Alarid-Escudero, is going to talk about evidence-based public health policies. Fernando, welcome. Could you tell us about your experience informing public health policies in Mexico, and from your point of view, how health is a cross-cutting issue affecting other development topics? I think you're going to share your screen, right? Fernando?
Yeah, that's correct. I would like to share my screen if that's possible. Although,
yes.
Okay, I think I'm able now. Let me see, I'll share my screen, my presentation. Can you guys see it?
Yes.
So do you guys see the presentation mode?
Yes.
Perfect. So first of all, thank you, Evelyn, for the invitation for such a wonderful conversatorio, and also to the Latin American Studies of the University of Dundee. We really appreciate the invitation and the opportunity to talk about our experience, some of the stuff that we are doing, and share all this with you guys. So you asked me a question. Is this something you would like me to answer now, or should I answer at the end of my talk?
At the end of your talk, at the end of your presentation.
Okay, perfect. So I'll talk about the COVID-19 epidemic in Mexico, and a little bit of how we can improve decision-making in the process of uncertainty, and especially in the process of uncertainty in these COVID-19 epidemic times. So I would like to thank my collaborators. There's a group, as I mentioned a little bit, a collaboration between CIDE and Stanford University. And from Stanford University is actually a more comprehensive team. It's just that Jeremy, the PI at Stanford, has been the most involved in the work that we've done in Mexico. I also would like to thank my technical and scientific team at PADECI and CIDE, which they are like a wonderful group of, some of them are consolidated researchers, and all of them, and some others junior researchers. And without the support and hard work of all of them, this effort of PADECI would not have been possible. And we don't have any conflict of interest to declare. And I'll just show for a few seconds our disclaimer that basically that there are no public policy opinions of the researchers of any of the institutions or research groups and that are involved in this analysis, and either projections or data analysis. So how do we make decisions in public health? In these times of the pandemic era of COVID-19, there's a decision that needs to be made. It could be either do nothing, implement social distancing, or become a little bit more intense in the mitigation strategies like suspension of work activities, schools, and closure of certain commerce. So the decision is, what should we do? And even do nothing is very, very important to make it clear that do nothing is actually making a decision, which is living the status quo. And that has, or could have potential implications. So when we face these type of decisions where clearly each of them have different trade-offs between benefits, costs, harms, on multiple domains, not only in health, it is where decision models become extremely handy. And what is a decision model? A decision model is actually a comprehensive framework that incorporates different components that will help decision maker make better decisions or more informed decisions. Some of these components that go into decision models are, for example, in this case of epidemic, of the COVID-19 epidemic, are the risks of future events, the costs, adherence to certain intervention strategies or mitigation strategies, how ideally would like the population to adhere to increasing social distancing, increase their hygiene, etc. probability of the disease. In this case, what is the risk of someone acquiring the disease given their current patterns and behavior. Quality of life related to health. Diagnostic testing rate, that is how much testing is done in a population. Apologize for the Spanish word here, is the mortality of the disease. So how lethal the disease is given that an individual, in this case, gets infected by it. Test characteristics, so how good the tests are at detecting the virus or detecting whether someone has been infected at some point prior to being tested. And we combine all these components into the decision model, that the decision model would spit out or produce health and economic outcomes for alternative strategies. And once we produce these health and economic outcomes, that could be either other as well as social outcomes if desired, if the decision model can allow us to produce these specific outcomes as well. And we quantify them and put them on a scale in a way that we can compare both of these outcomes, and it can eventually see what would be the impact on of certain policies or interventions that decision makers would like to implement. What are the advantages of decision models? Where they are clarified decision making. They provide comprehensive framework of making decisions, incorporate the best available evidence, which is key in these times where evidence is continuously evolving day by day. The doubling, I was reading that the doubling time of new research papers and literature increases quite rapidly. There's explicit and systematic characterization of uncertainty, which is very important in these times, where sometimes there are different types of uncertainty. Some of that uncertainty that arises from the sampling behavior of how much information I start collecting, if I collect at all. And there's another type of uncertainty, which is what we don't really know much about, or not anything at all. We just know there's some process that exists, but we don't have a lot of information about it. In this type of decision models, we can make explicit what that process is, even though we don't have a lot of information about it. We can extrapolate short-term observations, for example, how the epidemic is evolving in the short term, day by day, week by week. And then we can, from there, given a certain range or certain subset or set of assumptions, we can then project out what would be the long-term effects of using these short-term data. We can extrapolate results to different population subgroups. For example, we're doing some work on implementing our decision model to the prison system in California, which is a different kind of subgroup that behavior and whatnot is different from the overall population that are not in prisons. And especially it encourages the what if analysis. What if we implement this intervention? What if we lift an intervention at a given time, or we relax the intervention? So we can analyze all these different what if scenarios to provide information for decision makers to get a sense of what could happen if they make a specific decision. I'm going to talk about the model that we use, that we have used to help decision making and inform the decision making process of at different levels in the of government and for other decision makers. So as I mentioned, we partner with some researchers at Stanford University, and we developed the Stanford CIDE coronavirus simulation model, and we call it SC-COSMO. It's based on a mathematical epidemiological model of differential equations, and we coupled an intervention model and a healthcare usage module. So we can describe the dynamics of the epidemic, and also we can evaluate different kinds of interventions and how much people, based on this intervention, what will be the impact on the usage of healthcare resources in a given population and context. We use the most recent scientific evidence on both the virus, SARS-CoV-2, and COVID-19, which is the disease caused by such virus. And we use most currently available open data to implement SC-COSMO. The idea with SC-COSMO, more than being just an epidemiological model, is to have to create a dynamic real-time decision-making system in which we obtain real-time data that is produced constantly day by day on both the evidence side of the research side and also on the evolution of the epidemic on a given context. We incorporate that data into the model. We produce outcomes and outputs based on different scenarios that decision makers would ideally like to evaluate, quantify these implications of such interventions, and we inform decision-making based on this. Now, once individuals or decision makers make a decision, then this data will be affected. Why? Because if they make more stringent such interventions, then the data on the evolution of the epidemic will change, and we take this new data and put it in the model and again produce outcomes. So that's why it's a system, a dynamic system. It's been adapted to several countries and populations. For example, we have adapted in Mexico by the different states, applied to the state of California by counties. And we also have information to adapt it to all the counties in the United States. We've adapted in Brazil by states, and we are currently adapting it to India by states to inform decision-making over there. This is just an example of one of the outputs of, or visualization of the outputs of the model. So we can evaluate different strategies for different states, so decision makers can select what strategy or under which, for which state they could are interested in seeing projections on a specific outcome. It's an epidemiological model, and this type of epidemiological models are usually represented as they are called compartmental or compartment model, and they have these state transition diagrams or compartmental diagrams. And these are derived by a set of equations, mathematical equations that determine how different outcomes evolve over time. In our case, we have split all these outcomes and health variables by age, by different age groups, severity classes, and whether they could be they develop symptoms, and once they develop symptoms, whether they could be diagnosed. So what could we do with the model? Evaluate different interventions like do nothing, social distancing, suspension of classes, suspension of work activities, closure of establishments, and active case search. We can also evaluate the de-escalation of such strategies, and we can stratify them by age groups. Some of the questions that could be answered are, what are the number of sick individuals requiring healthcare services at a certain time, and what would be the deaths, the cumulative deaths over a certain time frame given different interventions? What would be the maximum demand for healthcare services at a given time? And also produces inputs to quantify economic and health impacts of the different interventions that decision makers would like to evaluate. Now let's shift gears and talk about how does the disease burden look in Mexico. Here I show the cumulative confirmed cases by state up to the latest data that was released by the Ministry of Health yesterday. And here we rank the different states based on their cumulative number. So the entity or the state in Mexico where we have the most number of cumulative cases is Mexico City, followed by the state of Mexico. Baja California, which has been quite an interesting case where it was one of the lowest a few weeks ago, but it has increased rapidly the number of cases. And there's most likely has to do with this interaction between Tijuana and San Diego, or Coronado, which is the actual city that is closest to Tijuana. There's it's one of the countries with the highest volume of immigration between two countries in the world. And California is also evolving quite rapidly in their evolution of the epidemic. But as you can see, different states have different phases in their epidemic. While some states such as Mexico City, the state of Mexico, and California have had quite big cumulative numbers over the past few weeks. There are other states like Zacatecas, Campeche, Chiapas, that their numbers are still quite low. So that means that they are still yet to see perhaps their biggest increase in cases in the next few weeks. Now it has to do a lot with testing, how much testing they are performing, but still we are expecting that the evolution of the epidemic will start increasing in such places. Here I show the incident cases, how many new cases have been registered in the system per day. And we see that in here in Mexico City and the state of Mexico, there was like a rapid increase and looks like it's decreasing. However, it is important to note that there's a delay in the registering system. So it takes a few days to actually come up with a stable estimate or a stable number of the new diagnosed cases per day for the past days. So let me zoom on 3 states in Mexico. So in yellow, we have Mexico City. In red, we have Hidalgo. And I show Hidalgo because it's one of the states that we work closely with, and Aguascalientes, which is the state where CIDE, Región Centro, and PADECI are located. As you can see, we have a rapid increase in the number of cases per day, and then looks like it's going down, and eventually, using the last data, we have a very tiny number of cases. But this is an artifact, or could be an artifact, because if I start going in the future and start collecting the data that we are showing, for example, the May 10th, we'll see that in the next few days, most likely that these numbers will increase, because it takes a while to get these confirmed cases into the system and being released openly as they have been doing for the past month or a bit over a month. I now show the cumulative deaths by state. And again, we'll see that the deathliest, or the place where the highest number of cumulative deaths is Mexico City, followed by state of Mexico, and Baja California is the number 3. But we still see not such a difference now as in the cumulative number of cases between the different states. And there's been some controversy that the case fatality rate, which means the proportion or the probability of someone being diagnosed dying from COVID-19, is actually quite high compared to other places. That has to do, perhaps it could be more lethal, but also how information is being quantified. I just show here the cumulative, not the cumulative, the incident new deaths per day. Also, we see a decrease, but as it's been mentioned even by the authorities, it takes a while to incorporate a new evidence into the system and make it publicly available. Sometimes it could be a 14-day delay on this information. And here again, I just show the incident deaths per day in the 3 states. Now, sources of information. So we use the time series of cumulative and incident confirmed COVID-19 cases and also COVID-19 deaths, and they are available on the following website. We use demographic data. So in terms of the total population size, the structure of the population, the specific overall mortality rate, which determines the mortality from all causes other than COVID-19. So individuals face a natural mortality rate that could be attributed to other causes that are not related to COVID. And we also adjust this information to determine the contacts between between individuals of different age groups, given by the density of the population in a given place. And this is just an example how we determine the number of contacts between individuals of different age groups. And this is the actual matrix that we use for Mexico City. We take information from published literature, and then we adjust those contact matrices by the population density of the population of interest. And now end by showing some projections that we have produced for Mexico City based on the latest evidence on, as I mentioned, on the dynamic of the virus and the disease, and then publicly available data that was published by the end of April. So the first exercise was what would happen without any intervention, or what would have happened had the government not implemented Jornada de Sana Distancia, which is the national mitigation strategy that happened on March 23rd. We said, had it not happened, this intervention, which is shown by the vertical dashed line, would have found a peak in the first days of May, around May 6th. But we know that the mitigation strategy was implemented. Jornada de Sana Distancia got implemented. So we saw that based on the projections that we produced, based on the evidence we had access at the moment, that this curve got flattened. And it got flattened because it reduced the acceleration of how individuals, susceptible individuals, which means that individuals that are at risk of becoming infected if being in touch or in contact with an infected individual, we were able to flatten the curve. However, we run the scenario which what would happen if the government lifts these interventions by the end of May. Then we see that a re-peak of the epidemic. And we see this behavior, and it's a common behavior seen in projections, and not only in projections, but in actual some case studies in which governments start relaxing or even lifting the mitigation strategies, and then we see another increase in the acceleration of new cases. And the reason is because there's still a lot of individuals in the population that are still susceptible. So that once they're in touch or in contact with infected individuals, we see an acceleration in the infectiousness. Then we did another scenario, which is what would happen if we continue with this mitigation strategy for 1 more month. Yeah, we continue flattening the curve, but then once we lift this intervention, it peaks again. So it increases the velocity at which individuals get infected. And finally, we see the typical flattening the curve figure in which if we continue with the mitigation strategies all the way to the end of the projections, in this case, the August 31st, we'll see a completely flattened curve. And these are just the numbers from the figure I just shown. But I just want to finalize that it is important for everyone that sees projections and releases projections and make them publish. It is important, what is the end of the projection? What is the end date of the projections? Because we will see that if not all individuals become infected or becoming, on which they will develop immunity, it is more likely for us to see projections in which epidemic continues to rise again after a certain period. So it's important to say, where is the end of the projection? And so I will end here, and just happy to take any questions at the end of the presentation. Thank you very much.
Thank you very much, Fernando.
Also sharing my screen.
That was, oh, sorry. I will. Okay, perfect. I will share my screen now. Can you see it?
Yep.
Okay, perfect. Thank you very much, Fernando. That was very useful. And now we are going to close this talk with Roeland's Hemsteede perspective on how social protection can play a role to cope COVID-19 negative consequences. Fernando mentioned that health is also related to some economic bad consequences caused by COVID-19. So we would appreciate your insights on how social protection can play a role to mitigate those consequences. The floor is yours.
Thank you very much, Evelyn, and all the others from both the Latin American Society, but also from CIDE for bringing everyone together today around this topic. Yeah, as Evelyn says, I will today focus on social protection and how that can help in sort of mitigating the impacts of COVID-19. Given the wide range of backgrounds of people that are around, I will start the presentation to just mention briefly what social protection is and what kind of interventions we can think of. Then I will take a closer look at how social protection is arranged in Mexico and what Mexico is currently doing from a social protection perspective to sort of mitigate or respond to COVID-19. The picture I put here on the right, I want to draw your attention to it because a large part of Mexico's population is working in sort of the informal sector, such as market vendors, etc. And that is a group that is particularly prone to the negative consequences, but who we also could reach through social protection. So if we can go to the next slide. So social protection is generally understood to refer to all public and private initiatives that can provide support to poor and vulnerable groups in society and to protect them from a number of livelihood risks with the objective of reducing their poverty and reducing their vulnerability. So I won't go through all of these, but on this typology basically in the figure, you can see social assistance, which generally consists of cash transfers, of public work programs, but also subsidies or school meal programs, etc. So these are direct transfers to people without them first having I will myself. So these are programs where people do not have to contribute anything themselves. Another social protection pillar consists of contributory interventions. So here you can think about your healthcare insurance through your employer, or maybe a contributory pension scheme, etc. But those things are very often aimed at the people who are slightly better off and who have a formal sector employment through which they can contribute. Now, lastly, we can think about active labor market policies, which are policies aimed at protecting the labor market and making sure that people can find job once they are looking for it. So why is this, Evelyn? Can you still go to the previous slide? So why is this relevant in response to COVID-19? Well, I think social protection offers a means to reach some of the people who have been negatively affected by the pandemic by directly transferring resources to them or providing them with direct interventions. So this can be direct assistance, but it can also, through the labor market policies, be aimed at reducing the likelihood that they will need immediate assistance. And because social protection systems are generally aimed at the poorest and most vulnerable groups in society, these systems are already in place and they can just be built upon and expanded, as I will explain later, to make sure that you reach these groups without having to devise new systems or to start massive programs of enrolling people into programs when already capacity is stretched and where, because of social distancing, it can be quite difficult to create new registries. Okay, let's go to the next slide. So from a global perspective, what we have seen is that once COVID-19 started becoming globally recognized as a problem, the expansion of existing or new social protection programs by governments, UN agencies, non-governmental organizations has expanded very rapidly. So mid-March, we had only 48 countries that were implementing some form of support, such as the well-published £1,200 check in the United States, or the British furlough program, whereby companies receive a subsidy basically from the government to retain their employers or employees. But now, 8 weeks later, we see that 171 countries have already adjusted existing programs or are creating new programs. And while that sounds great, there are quite a lot of challenges as well in this process. First of all, we see that social protection interventions in general, including in Mexico, as I will soon come to, are generally directed at the poorest and most vulnerable groups in society, and often aimed at the rural areas. Whereas with COVID-19, we see that a lot of the people who are affected are typically people that wouldn't qualify for social assistance. So these are people who live above the poverty threshold, who live in urban areas, etc. And I think this is also where I want to draw explicit attention to the plight of informal workers who are typically not covered by social protection systems because their income is above the usual threshold for programs. But it means that from the government's point of view, they are not on their radar. They are not registered in a system, etc. However, for them, because they often do not earn enough to have substantial other benefits through unemployment insurance or a proper healthcare insurance, they are particularly at risk as they need to carry out their market trading or whatever to survive. So they are not only exposed at increased risks because of their need to continue to work, but they are also a risk factor in the sense that they're engaged. Now let's move over to Mexico. Yeah, next slide, please, Evelyn. So when we look at Mexico, we see that out of its population of more than 120 million people, approximately 40% lives in poverty, with a large share of those being considered to be extremely poor. And more than half of the poor population consists of women, and about a quarter of the indigenous population is considered to be poor. Here, I think it is important to note that Mexico measures poverty in a multidimensional way. So I'm not only talking about the financial poverty or destitution, but also about people not having access to quality healthcare or quality education. And in times of COVID-19, where we have in general more difficult access to education, to healthcare, etc., it means that the people who are already poor might face even increased burdens. And in Mexico, the ILO estimates that about 60% of the work that is conducted can be classified as informal work. So you can just imagine that there is an enormous segment of the Mexican population which already before COVID-19 was living a precarious life. And now with the economic downturn, they might be faced even more. So in general, Mexico has a range of social protection interventions. Some are social assistance interventions, such as Prospera, that I will talk about, but there are also a lot of health and pension benefits that are directly tied to formal employment, which is a problem at the moment. So what is Prospera, Mexico's flagship social assistance program? Prospera is a very large anti-poverty program reaching about 6 million households with the aim of reducing the intergenerational poverty of people. So it does this by providing direct cash transfers to households, especially households with children, on the condition that children attend schools, that mothers attend healthcare clinic visits, etc. And if people fail to comply with these conditions, they risk losing their benefits. So under the Prospera banner, there are 14 different interventions that are aimed at providing food support to people, school meals, basic health support, an old age pension, subsidies for utilities, etc. And what I think is particularly important here is that, unlike in many other countries, Prospera also covers a large part of the urban population, even though it is still primarily focused on rural areas. But because of that and the fact that COVID-19 has been concentrated in urban areas, I think that's a benefit of the existing system. And I think Prospera has been operating or active under various different program names since 1994, and it is currently delivered by the Ministry of Welfare. But because it has been doing this for 25 years or more than 25 years already, the systems that are in place are fairly robust, and they have been consistently evaluated through their Council for Evaluation of Social Development Policies, which means that it is much more capable of delivering responses now through systems that are already in place. So one way this could be leveraged is by what they call a horizontal expansion of social protection, whereby you see that new people who previously wouldn't qualify for benefits will now be enlisted into the program. So here we can think of the informal workers who are suddenly becoming extra at risk. At the same time, we could see the program expanding vertically, which basically entails increasing the benefits to existing beneficiaries as their needs and their vulnerability increases. So I think the existing programs within Mexico offer quite an opportunity to leverage. And if Evelyn goes to the next slide, I'll discuss some of the ways in which that's currently being done. Yeah, so basically this table shows the different areas of intervention where social protection is currently being expanded or adjusted in response to COVID-19. So in terms of direct transfers, we have seen that the Mexican government has said it will bring or fast track pension payments to people. So instead of people normally receiving a pension payment every 2 months, now they will get a lump sum payment of 4 months. So the government is bringing forward one of the pension payments. And that might make sense in terms of addressing people's direct needs. But obviously the longer term implication is that if in a couple of months they then do not receive a pension payment anymore, they might still face problems. So it's moving the problem backwards. So I think from a policy perspective there, it's important to think about how do we avoid an increased shock in a few months' time when the effect of this measure has reduced. We've also seen that the government wants to expand its public works program, especially in rural areas. And I won't go into all of the responses in detail, but I think there's two worth flagging. One is a program of concessional loans for micro enterprises, where they can apply for this loan in order to sort of cover their existing running costs and to still have an income. Practice will, of course, have to show out how successful this is in reaching the poorest and most vulnerable micro enterprises, because some might not be officially registered with the state. They might be, bureaucratic hurdles to applying, etc. So the practice will show how successful it is. Another important intervention at the labor market is that the government is not intending to lay off any workers at the moment. So that would provide a lot of protection for the incomes of people working for the government and obviously thereby their households. So what we see happening overall in Mexico in how it leverages social protection is that it is very much focused on intervening in terms of trying to protect jobs and trying to protect people's ability to run their enterprise, but it does so by postponing the financial impact of the current economic downturn. So down the line, a couple of months when people will have to start repaying their loan, or when it no longer becomes feasible to keep everyone employed, there might be a sort of post-COVID hit in terms of the financial impact of things. And I think those were the main things I wanted to share. If Evelyn can move to the final slide. So if you have any questions, obviously I will be happy to answer them. Also, if you're interested in Prospera, there is a lot of information on this program, because it's one of the most widely studied and global examples of how to develop and run a social protection program. Mexico has an annual social protection week where different stakeholders come and talk about how different interventions work and the impacts on things like education, nutrition, etc. Also, at the moment, a platform called socialprotection.org is running a webinar series around COVID-19 and how different countries and systems are able to respond to this. They are all free to access, and I can really recommend that. Yeah, with that, I want to thank you for your attention and look forward to your questions. Thank you.
Thank you, Roeland, very much. So that leads us to the Q&A session. We have asked the audience to send some questions during the week, and we have chosen 2 of them. Please feel free to answer them. They are very broad, and I believe that you can answer, if you want to, answer from your area of expertise. The first question, if home quarantine is not viable in the long run, what other alternatives could be implemented? Who would like to answer that one?
So in the judicial system, I think many other countries in Latin America are already doing that. And for example, Colombia is having court sessions virtually. And for domestic violence, some countries are having teleconferences. So like, let's say like the process is still going. Also some other judicial processes via online sessions. And Mexico also declared a decree to guarantee continue essential services, and especially for gender-related agenda, this has been guaranteed as an essential service. So I think the main challenge is what to do with the people who don't have access to internet or who don't live in the city, and how can we approach the judicial system to them if they don't have access to such services. So I think that's one of the things that Mexico is already doing, but we need to come up with alternatives to have a solution to that.
Thank you very much, Martha. I don't know if anyone else would like to add something to this question.
I mean, if that's okay, I can just come up with a couple of comments.
Okay.
So it's understandable not everyone can do home quarantine for sure. And so my answer has 2 components. The first one is, if you can do home quarantine, please do it, because that helps a lot. This flattening the curve business, and it's not only on the cases, but on the burden to the healthcare system. If then that's not possible, and you have to be out and about in your activities because you cannot just stay at home, which is completely understandable, it is important to maintain social distance, hygiene, and try to reduce those contacts that could potentially lead to an infection. Even though some of these mitigation strategies can be lifted, it is very important to continue with this hygiene. Be conscious that the epidemic is not over. It's not over almost anywhere in the world. So it's very important to, if you can stay at home, reduce your contacts in any way you can. That's what is very important to do. And I don't know if this question was related to as a policy one or more as a personal. So I try to just respond as an individual. What can we do? And it's very important that the collective action from individuals can help a lot mitigate and reduce the potential negative consequences of this epidemic.
Thank you. Javier, do you want to say something?
Yeah,
Okay.
I would like to address also the other situations that are coming up, as well as the health problem is on us in Mexico, that we are facing the consequences of these first episodes of the pandemic, and different instances of the government in the social sector and in the private sector are understanding, I think, but we need to promote it more. We need to spread it more, that things are not going to come to normal after this quarantine ends. And there are a lot of things that are going to change in our normal, or in our new normality, in our new ways of facing this reactivation of the economy. So I would like to point, for example, these documents that we are promoting from, for example, the National Council to Eradicate Discrimination, about the relationship that should be promoting, and the acts that should be eradicated of discriminations with people that have been in contact with COVID-19, or who had a familiar, a relative that were in contact with this disease. So this needs to be adopted in institutions, in public institutions, but also in corporations, in the schools, and these the hygienic measures that they were told just minutes before will be complemented with these other measures about our relationship and our empathy with people that have been suffering the most with the COVID. We haven't talked about a lot of other people that are suffering, but we also have the migrants in Mexico that haven't been attended, I think, in the most correct way in the first part of this pandemic. But there are like a lot of measures that have been reconsidered to help them. Not only the ones that are in transit in Mexico, but also the ones that are being deported from the U.S., because the U.S. has not stopped to deport people in this pandemic. But we're also talking about people that are in treatment, in mental illness, kids, no, that needs to reactivate their school formation. So the strategy is not only about eradicating the public health problem, but to make us reactivate also our projects of human rights protection, the problems of development that we are facing now, and the strategy is also going to take a lot of measures that are complementing this hygienic and the staying home ones. No?
Okay, thank you very much.
Yeah, so I think from a social protection perspective, it would be perhaps advisable to continue and perhaps expand the cash transfer programs, because it reduces the need for people to directly go out onto the streets and do their jobs and use things like public transport, etc. So while it is not an alternative to home quarantine, it can make home quarantine more, or it can prolong the duration for which home quarantine is viable. So I think that is extremely important, especially because cash transfers and social protection tend to be a relatively cheap way of delivering support to people, because the infrastructure, especially in Mexico, is already there to do it. You don't need a lot of additional resources to transfer larger pensions or other social contributions to people. So it is relatively low intensity, but it can make a great deal of difference for people. At the same time, you could think about how you can transition or change existing programs such as school meals to things like take-home meals or food vouchers, because especially in a lot of the poorer areas, many people rely on school meals in order to get good nutrition and to get sufficient food. So if you want people to stay home, you have to think about the implications of them not being able to access things like nutritious food anymore. So you can perhaps adapt existing programs to make it more viable to reduce social interaction. Thank you.
Okay, thank you, Roeland. The second question is, what are the factors that might influence a larger impact of COVID-19 in Mexico? Again, this is a broad a question that could be also answered from your areas of expertise. Thank you.
Okay, I will start off saying that one of the biggest factors is that we don't have first responders trained on psychosocial health. So we need to address that. Not only like first responders as police, but also in the health sector. So we would need to invest a lot of effort in training for first responders. Also, we have a high level of violence even before COVID-19. So this just exacerbates everything. And what we talk about the informality of our economy, and with 50 million people living under poverty, this just makes it harder for us to have like a good comeback after COVID-19, the access to internet, and also in terms of the statistics, I think we need to have more sex disaggregated data in terms of to see how much the impact of the interventions of public policies is and how it affects women for better or for worse. And also what I'm worried about is that if Mexico decides to come back to normality too soon, many households depend solely on the woman. So if we go back too soon, they have to go back to work, and then the children, if schools are not expected to go back until August, then who will be the care providers of those children? So that would be my intervention.
Thank you, Marta. I don't know if someone else would like to answer this question. Javier?
Yeah, there's a factor that we didn't talk about it in this session, but in Mexico we are facing also the complexity of the federalism, this relationship between the local governments and the federal government. Because, well, there is so much information, there are so many studies, there are so many points of view in this topic. Even if the health department has like a clear statement about the measures they are taking off and why they are taking them, we have a lot of states that have taken like their own initiatives to understand the pandemic in a different way. And maybe they can have positive effects on their states. I need to recognize that every state in our country is different. No, the economic conditions of one of the states will be really different from another. But it also sometimes makes it difficult to give a correct development of the strategy. No. So we have a document of the High Commissioner of the Human Rights, and the Secretary of Government in Mexico that has expressed the preoccupation, the worries about the human rights violations of the local strategies and how they are exceeding in the privation of human rights or in the limitations to human rights and liberties by trying to address the coronavirus situation in their own cities. So the national government has expressed that we are going to maintain respect of all the human rights, not try to not enter to these kind of measures that are more restrictive, no, to appeal to the accessibility and the social compromise of people. And I think that's a correct strategy. But in some cases, we have faced it with mayors and governors that are trying to do it in another way. So definitely that is a factor that is we need to have a really good relationship between the states and the federal government and the cities to stop the mitigation of the disease. No.
Thank you very much. I don't know if someone else would like to contribute. Okay, Fernando.
Yeah, thank you. So I'll just talk from the epidemiological side. What could influence a larger impact of COVID-19 in Mexico is always a question whether if you lift mitigation strategies too early or too soon. And there are consequences. There are going to be consequences of doing that. Perhaps positive and also negative consequences. So what is very important, I think, is to really that authorities show what are the quantification of those consequences. So what's going to happen in all these factors, economic, social, and health attributes when based on the decisions they're planning to make. Just is very transparent what we expect to happen. For example, if we lift them in 2 weeks, in a month, what could potentially happen to the economy by doing that, and also on the health side. What happens if we do it 3 months from now or in a week from now? So it's very important to show not only what happens with COVID, but also the effects on the other attributes or factors. So, and when we talk about the impact of COVID, it's also very, very important to be clear about it could have an impact on multiple domains. So just have a sense of all these different domains that are relative to decision makers and the population is very important.
Okay, thank you, Fernando. Roeland?
Yeah, I think I just want to build on and echo basically what Fernando was saying, is that while in this talk we mostly focused on the COVID-19, I think the impact can be potentially very large on the people who will lose their job as a consequence of the current situation. And that might have knock-on effects on a lot of other areas. So it is important that even though now we're planning and designing the response to COVID-19, to already look at what's going to happen down the line and what mitigation strategies, such as leveraging social protection, can be put in place to prevent the worst outcomes, because typically the ability of the poorest and most vulnerable groups in society to recover from shocks like this is the least. So well-educated people in an urban environment with economic opportunities might be better able to return back to their pre-COVID lives once the epidemic is reduced. But for people who have had to sell off their productive assets, who had to not go to school or whatever because they have to work for an extended period of time, there might be much longer term implications that go way beyond the health implications. So I think that's just something to already start factoring in the way we design the response. So thank you for that.
Thank you very much. With this, we conclude the academic talk. I would like to thank our wonderful panel and also the audience that have listened to us today. I would like just to briefly say that we are going to continue delivering academic talks. So please stay tuned. I share our social media. And thank you very much. See you soon. Bye.
Bye-bye. Thank you.
Thanks, everyone. It was a pleasure.
Thank you. Have a nice day.